November 30th, 2020. Hi, my name's Tom Yakopin. This is the Tom Yakopin Podcast. Welcome aboard. Excited to introduce to you our guest today, Dr. Kimberly Legg Corba. She is going to tell you a little bit about her background. She's also a Pennsylvania native. We were just kind of yucking it up before we went live about, growing up in the hills of PA in my case, or, she's out in the farm country in eastern PA. So I think we're going to have some fun today, and I think you're going to learn some things. Dr. Corba, thanks for joining me today. I'm excited to hear a little bit about, who you are, your practice. I think your practice is Green Hills Family Direct. Is that correct?
Green Hills Direct Family Care. Yes.
I'm sorry, Green Hills
That's okay.
Direct Family Care. So tell me a little bit about yourself. Why the medical business? What was your passion? How did you get involved, and how did you wind up going with what I believe is a very innovative and practical approach, direct primary care? Tell us about you and your practice and how you serve your community. And by the way, welcome.
Thank you for having me. Thank you for the introduction. It's a pleasure to be here. I went to high school and college here in Allentown. I went to Parkland High School and then Muhlenberg College and attended medical school in Philadelphia. And I had an urban type family medicine residency where we all trained, any family medicine residents at PCOM, trained in federally qualified healthcare clinics in some of the poorest areas of Philadelphia, North and West Philly. So from very early on, we were taught to really, make primary care serves the underserved. That was just part of our training. And always, remained in the back of my mind. And as I went out into the world after I finished my residency, my first job was 4 years, and I worked for a larger hospital system in Norristown outside of Philly. And they were already, it was already starting to feel some of the creep of the executive suite on us back then in the late 90s into the early 2000s. And then we decided, my husband and I, he's also a physician, decided to move north to Allentown, get out of Philly. We had our son was a year old at the time. He's now 20, and be closer to family and friends. And so we came up here, and I already had decided I really wanted to be in an independent practice that wasn't managed by a large corporation, just because of that first taste I got out of it right out of residency. And that's before it got really bad for, to work for corporate entities. And so along the way, I decided to open my own practice. And, we put up our house as collateral. This is back in 2003. My husband was very understanding about it, very supportive. It was very scary to hang a shingle on your own back then. It was probably the last moment in time in U.S. medical history that doctors could actually hang a shingle. There were still independent practices back then, and you could open on your own and control part of your overhead, which is where I'm sitting in my overhead right now. I've been here for 17 years in this office space. So knowing that I could control part of my overhead, I knew I could be a small family practice and still be a mom to my children, and kind of do it the way I was trained to do it, spending time with the patients, not having somebody breathe down my neck about, whether every appointment was booked during the day. And, I didn't go into family medicine for the money. I did it because I love it, and for some of the flexibility. And I wanted to be able to practice the way I was trained. And PCOM, on top of serving your patients, really instilled in us way back in the 90s, preventative medicine and the holistic approach to the patients. So especially those with chronic illness. So my practice grew from 2003. It was just when I opened my doors. I opened with 0 patients, marketed on my own. I got pregnant with our second child the second month I was open. But at that time I was 36, so I knew it was do or die. So I was going to have the baby the first year I was open. She's our second, our daughter. And patients didn't blink an eye at it. They were fine as long as they knew I was coming back after I had Cameron. They were fine with it. So it didn't impede the growth of the practice. In fact, it probably helped it a little bit because, patients like when their doctors are human and going through life
Right.
changes themselves. So the practice slowly grew. We had some rapid growth phases, but it grew and grew and grew. And before I know it, I had a panel of 2,500 patients, and the Affordable Health Care (ACA) passed. And along with that came the mandates for going to EHR. The quality reporting was pouring down on us. I watched the internal workflow of the practice where I had some control over overhead fly out the window. My overhead was going up. The amount of work, administrative work, was going up. The time I was spending with patients was going down. The insurance companies were dictating whether we could take care of an acute issue during a physical at the same time. We're not allowing that. I was having to tell patients they had to come back for the acute issue or handle the acute issue and reschedule their physical, because I had to start seeing more patients faster because reimbursements were flat or tied to quality care. My time with my patients was being whittled down to like 7 to 10 minutes. So if, like, my elderly patients came in with their list of 5 problems, I couldn't address all 5 problems, or I'd be an hour behind in my waiting room. And my patient's time is as valuable as my time. People were taking off from work and
Absolutely.
sitting in my waiting room and having to pay a copay to come back a second time because of stupid insurance rules. I was really getting frustrated, along with the rest of the physicians out there. My story is not unique.
Hmm.
But I was in
It's
a position.
can I ask you to pause for just 1 minute, just
Sure.
for our listeners' sake, okay? Just to summarize, because you've said a lot that I think I get and you get, but I want to make sure our listening audience gets, and that is that as a physician, you became, as many other physicians are, you became frustrated because it sounds to me like you wound up serving corporate interests rather than serving primarily your patient. Can you just explain, the dynamics, and because a lot of people watching this, they're not going to be in the medical field, and I want them to know what doctors are facing and what some of the mess that both government and big insurance has created for our frontline physicians, our primary care physician. So
Right.
please elaborate on that.
So what was going on behind the scenes, patients, some of them knew, some of them didn't. And it's really important for people to know what goes on behind the scenes and what started back in 2010 um, with the passage of the ACA and a little bit before that. Um, the amount of administrative work relating to the insurance companies and the government's efforts to control the cost of care, which we we get paid what we get paid. We have the doctors have no control over what they charge. Well, actually, we could charge $1 million for a visit. We're only going to get paid so much by the insurance company. That's predetermined. So
Right.
we're not setting our fees, and on top of it, we were having to do more administrative work for the same fees and spending less time and seeing the quality of what we were providing for the patients. And the time is up. Forget the blood pressure management and the diabetes. If you don't have the time with the patient, especially in primary care, you can't practice to the top of your ability level, and you're not going to develop those
Right.
relationships with those patients where when they walk in the front door if they're not feeling well or not, just by looking at their face or talking to them on their phone or hearing their voice on the phone. That all takes time, and we are all taught in medical school that history is 80% of the diagnosis, taking a history, and you can't get a good history in just a few minutes. So
Five to
behind the
seven
scenes,
minutes. No.
right. So not only was our time with the patient, which is, that's golden, being whittled away. It was being whittled away for administrative stuff that had nothing to do with the delivery of care to the patient. It all had to do with controlling the cost over which we had no control. If we had control, we would lower all the costs. That's what I do now. But
Right.
we had no control over how we were practicing our profession, and it was all over the almighty dollar while we're watching these entities rake in billions of dollars a year in profits at the and it was at the sacrifice of what we were providing as far as care in the office. And I mean, if I still have all my quality sitting right over there, I have all my quality ratings from 2010 to 2014. I rated #1 in quality over all the practices in one of the large health networks here, and that include owned practices. I was still one of the last independents. For 4 years in a row, we were rated twice a year, so 8 rating periods. I rated #1, and I still questioned how they were rating me on some of this stuff, and the insurance companies couldn't answer me. We probably gave them one of the most hard time that any practices, because I would go through my ratings with a fine-tooth comb, and they couldn't answer half my questions. And all of this was in an effort to try and control costs. Absolutely ridiculous. There's better ways to control costs and continue quality. And #1 has got to be price transparency.
Right on. And you know, it seems very often that when central planners, whether their intentions are pure or not, it seems very often that when they get in and by decree, right, begin to you know, an all one size fits all approach, that there are these unintended consequences. Like, it sounds good to the consumer that government, through the Affordable Care Act or what other mechanisms they've used, are going to try and whittle down costs, right? But the consumer doesn't realize what it's doing to the primary care physicians, who are in many cases being burned out, feel disenfranchised. Just as my physician here, which is a direct primary care physician, she said, Tom, 80% of my time was spent doing administrative things, 20% for care. And then she flipped it by doing what you're doing, which is I think a fantastic solution, and I salute you, by the way.
Thank you.
But people don't understand, you know, and I talk in my industry, I speak to a lot of people, and very often, you know, I hear, you know, I go to see my doctor, I was on time, and yet I still had to wait 20 or 30 minutes in the room with a mask on, and there's all these other people there.
Yeah.
And then finally, when I hear, you know, finally I get 5 minutes, and then they're just pushing pills or whatever, rather than the relationship. And I think, you know, from a risk management strategy, I've studied some numbers and realize the importance of a physician patient relationship. Just what you said, getting to know your client, your patient. How important is that?
The patient is the center of it all.
Go ahead, I'm sorry.
That's okay. The patient is the
Yes.
center of it all. And it has to be, and that's the oath we took, is to our patients. And
Yes.
when finances are tied into the patient care, in my mind, it's you know, and it's interfering with that oath. And unfortunately, corporate medicine has become has gotten itself into such a position that many physicians aren't able to make any choices. And I'm blessed that I was able to make a choice in transitioning my practice. There's a lot of physicians out there who are contractually obligated to these large corporate systems and don't have the choice. And here we are. The whole thing with the Affordable Care Act, it helped a lot of people. I'm not disparaging that. It helped a lot of people who needed help. It did leave a lot of people out in the middle class, got whacked by it. Small business owners got whacked by it. It left a lot of people out too. So it's not a be all end all solution. But the whole reason for it was the Affordable Care Act. Why are we trying to afford something that is unaffordable? Why aren't we getting to the crux of the problem, which is making it unaffordable and required an Affordable Care Act by looking at the costs? If we could lower the cost of care through multiple ways, the government would save money. More money could go into other programs that need it. The government, Medicare, Medicaid would save money. The private insurers wouldn't be happy because their profit margins would go down, but that would eventually be passed on to the consumer. Imagine state Medicaid programs. If they could save money, if price transparency and a lot of the other things that have been put forth by this administration this current administration. If they could, these state Medicare, Medicaid programs could save money, where else could that money be spent? There's no reason a
That's
chest
right.
X-ray needs to cost $400 or $500 when I can get a cash price of $40 down the street. That's the taxpayers
Right
paying
on.
that money. That money should be funneled into mental health, maternal fetal medicine, other things out there. I don't understand why we're trying to afford something that is unaffordable. And I don't, it's an oxymoron in my mind. So
Well, oh, it is, and I think, and I want to get into how you guys flipped it with your direct primary care practice and some of your prices. But allow me to interject this. I think it was Mark Twain who said, "It is easier to fool a person than to convince a person that they've been fooled." I find it, that when I talk with a lot of consumers who, they've drunk the Kool-Aid, so to speak, the insurance Kool-Aid, whatever, they don't realize that laws like the Affordable Care Act or these health plans that are steering patients to what I call the company store. In other words, buy an expensive, clunky managed care plan. If you're in the working middle class, the premiums probably look like a mortgage. It still
yeah,
has a deductible. It still has copays. And you have to go to the company store, right? Meaning
yep,
like my grandfather, who was a coal miner, where they have the prices secretly rigged and you don't even really know what's going on behind the veil. And,
right.
and ironically, people don't realize it, but many times with the insurance, they are going to pay more for that CT scan, that CAT scan, that X-ray, that lipid panel test. They're going to pay more with the insurance than if they just went cash, okay? Which is
That's
part
true.
of direct primary care, isn't it?
Right. The majority of my, more than half of my patients have insurance in this practice. It's just that they figured out
Yes.
it's cheaper. It's like they save money by getting their primary care through me and staying out of the urgent care and the ER and, away from the specialist as much as possible. We can't avoid it all the time. They figured that out and getting their medications wholesale and paying through my dispensary, even their over-the-counter medications. They have figured it out. We are not explaining when people call who are interested in the practice. My staff does not have to explain direct primary care like they did 4 years ago. People are figuring it
I
out.
see.
But the more people need to figure it out. Um,
Right.
and there's this Stockholm syndrome where we understand we need insurance for this catastrophic, God forbid. And I had breast cancer at 41. I'm a 13-year survivor. I understand the need for a catastrophic
Yes.
plan. Um, but to hold on to it like a whoopee and to not think about, okay, I have this catastrophic plan, it's costing me this much money, which is almost unaffordable. How can I save myself some money without having to implement this plan, on the back end? And that's where we're seeing people get creative and understand that good primary care can save you money in the long run, even though you're paying for this expensive plan. We have a lot of people in the health sharing
Talk to
plans.
me about your practice.
Um,
Talk to me about how do they save money? Somebody calls you. They want to learn about your practice. And again, the name of your practice, if somebody wants to reach out to you, how about a shout out, the name of your practice, your website, and we're going to
okay.
put it up on but go ahead, if you don't mind, a little self-promotion too, because I
Well,
want
it's
people to
called,
be able to reach you.
okay, it's called Green Hills Direct Family Care. And the website's www.greenhillsdirectfamilycare.com, all one word. And I want to put a plug in. We have more than 30 direct primary care practices across the state. And we have a nonprofit group called the Pennsylvania Direct Primary Care Association. We have a website. You can actually go on and locate a direct primary care doctor near you in the state. And it's called PADPCA, Pennsylvania Direct Primary Care Association.com, PADPCA. So you can go on and read about direct primary care, find a DPC in your location. We have grown across the state since I opened 5 years ago, and it's
Good for
really
you.
nice to see that. Yeah. So
And so somebody calls you, what are they going to find out? How does the consumer benefit? Talk a little bit about your pricing. Do you have a subscription fee? And then obviously you do, cold flu visits,
Mhm.
preventive care, but I don't think you're limited to that. I think you guys have quite an array of services that you can provide. I'd like you to talk a little bit about that as well.
Oh, we suture, lacerations, within a certain guideline. Some of them are complicated and will require, a plastic surgeon. But, generally cuts and scrapes and stuff you go to the ER for, we can handle in the office. Which I do pap smears. Um, I do small lesion removal as long as it's, not something too worrisome. Um, I do nebulizer treatments, joint injections. We do EKGs, spirometry, breathing treatments. We dispense the medications, annual physicals. I have a lot of patients who have a lot of complex conditions um, that are, require a lot of time and management coordination with other physicians. So, we do a little bit of everything. I do newborn care. I have a couple newborns in the practice. I have a couple nursing home patients in the practice. So it's cradle to the grave. I do enjoy the adolescents and seeing them, and it's
Mhm.
been a rough time for them, with this whole COVID thing. So
Yeah.
yeah, a little bit of everything.
But the concept of direct primary care fundamentally is that your patients are paying your practice for a subscription to
Right.
become an ongoing patient, and then they pay cash in a transparent world, which to define transparency, in other words, you let the consumer know, for the most part, this is what this procedure is going to cost. You're cutting out the middleman, which is a
Hmm.
smart way of paying for small stuff, right? It's
Right.
foolish to insure a coffee cup or a television. And not that $350 for a CAT scan's a small deal, but by cutting out the middleman, we're finding that people don't need to insure the sniffles, hiccups,
That's right.
nosebleeds, blood draws, right?
Right.
They buy insurance for the big stuff, but they're investing money in relationship with a quality practice such as yours. Is that a pretty good summation of
It
direct
is.
primary
And
care?
yes, so for a monthly fee, my patients get unrestricted amount of visits. They could go the whole month without seeing me. They could have to see me 5 times in the month. With COVID recently, a lot of telemedicine's been going on. There's no extra charge for that. There's a lot of, that's a separate charge with the insurance plans. That's all included. And they get half-hour visits, guarantee everything's a half hour. Physicals and pap smears I'll book for an hour. Excuse me. So if
Sure.
if Mrs. Smith, who's 80 years old down the street, calls with a list of 10 problems, my staff knows to give me an hour. So we have prolonged visits. There's no waiting in the waiting room, which has been superb during COVID.
Yes.
Patients are loving that. And yeah, so it's a subscription and it's a set menu of things that they get. If there's an additional price, that is all transparent. It's $5 for a blood draw. This is all discussed up front. Our cash prices for our labs, for our imaging that we have with an independent imaging center, um, for any prescriptions that we can dispense. That is all upfront. It's on the website. The whole public can look at it. It's completely transparent.
Wow.
And we discuss it. And we'll shop. I'll even shop around with a patient for see if there's a better price for a CAT scan out there. We'll spend time in the office looking for the best price. Everything is transparent. So they can binge on their health care basically with me and save money on the primary care part of it. And the analogy you brought up is we use the homeowners or the car insurance analogy a lot. So our homeowners and our car insurance is for major catastrophic issues, but the car insurance doesn't pay for tire rotations and oil changes. And my homeowners doesn't pay when my faucet breaks or my toilet's plugged up. You know what
Right.
I mean? So that's the primary care and the routine stuff that shouldn't break anybody's wallet.
That's right. I agree with you 100%. And it makes so much sense. Do you find when consumers sit down with you who maybe came out of the old model, right? And they see how affordable your care is, quality care. And I find the same thing when I go visit with my doc. It's usually at least 30 to 45 minutes, right? And
Hmm.
sometimes she wants to know more than I want to tell her, from the standpoint of what am I eating, but
Yeah.
that relationship, but do you find, are your patients surprised when they see that a blood draw actually is
Oh
only
yeah.
$5? Or,
Yes.
I mean, they've got to be blown away when they see the real price of things because it's being kept secret from the consumer, isn't it?
Well, yeah, I just redrew a potassium on a gentleman today, and I drew actually a basic metabolic panel, BMP, $5.35, plus the $5 draw fee. And he's a Medicare patient. I just saved the government a lot of money, by the way. They don't realize it.
Right.
But
Right.
people see those prices and they're like, and so my lab is still making money off of that
That's right.
client bill price. And that's mind blowing that they can still make money off of $5.35 for BMP, and what they're making off, who's making the money? It's the middleman, making money off the
That's right.
much higher price that they're charging through insurance. So there's so
Hmm.
many layers. The middlemen have definitely contributed to the rising costs of healthcare, and they've been shielded
Big
by
time.
they've been shielded by you know the uh, um, the anti-kickback safe harbor, and all kinds of stuff that needs to be, and it needs to be taken away, and it needs to be broken down. And the patients are, I think, being hurt enough financially that they are now consumers of healthcare, so they're really looking at what their dollar is buying them. And that's
Right
what we
on.
say, we're the best buy out there for for your healthcare dollar. And you get the same
Yeah.
physician. That's what we get a lot of people coming who want their own personal physician. They're tired of seeing the rotating. um, and physicians don't like being rotated like that in the hospital system, don't get me wrong, but they have to listen to what their employer's telling them. But the patients are noticing that physicians are coming and going, they're not seeing the same person over and over again. And patients are getting sick of that too, because they're paying for a service, right? And they're paying a lot of money for a
That's
service.
right.
So
Yep. And I don't think they realize how things have changed a lot over the last 30 years. I recall going to a local physician in Cannonsburg, Dr. Sprouse, and he was a fan. He would come to the house if necessary,
oh
right?
yeah,
But the
mine
whole
too.
corporate world has changed so much. And I don't think a lot of it is for the good. But I will say this, that I really encourage our listening audience. As many know, I'm a spokesperson for the Free Market Medical Association here in PA that is doing its part to educate and unite consumers with physicians and various free market approaches to medical care. Direct primary care is a classic example. I think it's the best of the best when it comes to physician-patient relationship. And Dr. Kimberly Corba, I think you're a rock star in the movement.
Thank
I really salute what you're doing. I'd
thank
love to
you.
have you back on again sometime as a guest to
Be my
talk about some
pleasure.
other issues. In
Sure.
closing, the whole COVID business, and again, there's a lot of things I don't even want to, I'm so tired of it. But, people coping with COVID and the numbers and the politicalization of it, because I do feel
Yeah.
like the narrative is being weaponized for political gain. What are some things that you might say to folks that are very concerned about this potential virus and its effects? What are you seeing in your area, and what are some recommendations that you might make to individuals to mitigate their risk and to live life?
Well, I think the aftermath and the retrospective analysis of this will be very interesting in 5 years. Right now, what I've been telling my patients is this is a virus. It's just, and it can be deadly. There's no doubt about it. We have to protect the weak and the immune compromised and those that are at risk. 99.97% of people are recovering. Is it fun to get it? Some people get minimal symptoms. Some people get terrible symptoms and they recover. It's not fun to get it. It is scary. Um, but just like the the majority are, of the people who pass away, unfortunately, have other medical conditions, and those are the ones we really need to be protecting. We do, of course, yes, we do with the flu. Sometimes some younger, healthier people succumb, and that's not optimal, and that's not what we want. But we also have to remember not everybody who gets COVID is going to end up on a ventilator in the hospital. And that was the picture we were giving and we were seeing early on. First impressions are the most important. It was absolute chaos the first 2 months. We didn't know, and on the doctor's end too, we didn't know how to treat this. We didn't know how it was behaving. We were throwing everything but the kitchen sink at it. It was scary. So now that we've calmed down a little bit, we know how this thing's behaving. We know a little bit more about how it spreads. Aerosols on surfaces, etc. We know what kills it, what cleans, what cleaners work. And we know that there's some simple things you can do in the outpatient setting, like making sure you're taking enough vitamin D, vitamin C, the zinc, making sure you're using EPA approved cleaners at home. And I do agree with masking, in the 6 feet. You gotta respect that, especially with you don't know if the person walking
Thank
by
you.
you just had a dose of chemotherapy in the grocery store. You just don't know. Now, masks aren't
Very good point. Thank
100%
you.
either. Right, or the child who might have an immunodeficiency syndrome that you just walked by. You don't know. Now, masks are meant to protect the surgical field. So the surgeon is not coughing their germs into the open wound. Are they meant to be a filter from the outside? Not really. And the COVID virus is very, very, very small. When it's in a droplet, it does
Mm-hmm.
get bigger. Some of the materials will filter that. Most of what I see people wearing around out there, it's not going to filter at 100%, but it will protect somebody to a certain degree from coughing their germs onto you. It's not going to protect you from inhaling them so much, but people need to understand that about the masks. But they are important. So the simple things like the vitamins, the vitamin D, vitamin C, the zinc, wearing the mask and doing the social distancing, keeping our vulnerable protected. But one of the other things I told my people to do from the beginning, and it's just common sense, can't hurt. And they have had a few studies come out since then. In March and April, I sent out a mass email to my patients. I said, irrigate your nose twice a day with saline and do warm salt water gargles twice a day. This thing hooks to the back of your throat. Salt kills most things, salt water. And in specific concentrations. Irrigate your nose. It's great for allergies. It's great for sinus infections, and it's just common sense.
Great
And
point.
since then, they've come out with a study that talked about gargling with Listerine. Don't drink it, gargle and spit it out. Um, right. And some we're investigating the saltwater gargles too. Totally harmless thing to do. And I can
Yeah.
say that
No downside to it, right?
no downside to it. And now we've had some studies to back some of these common sense things up, back them up. So, and the whole hydroxychloroquine thing, and now they're showing ivermectin is helping. India, there's other countries that have been using the hydroxychloroquine since the beginning. It got so politicized, and it's such a shame because I do think it had a role and has a role. Hopefully, hopefully we'll get over that hump at some point. And there are doctors out there who have used it and has saved some lives. And I just, I wish that the doctors would have had, not in some of the states especially, I won't mention them, didn't have their freedoms taken away to practice the art that they trained for over a decade for, to have the state step in and restrict your ability to have a discussion with your patient about an off-label use or the right to try, to me, is a travesty. And I think that's going to be one of the biggest things that I think there were things we could have tried with some people early on that are going to be shown in the long run to be helpful. So yeah,
Well,
I have
thank
those
you
discussions with my
for sharing
patients.
your points.
Oh,
Thank
you're
you.
welcome.
Thank you. And we're going to land the plane. It's been really awesome speaking with you. I have like 90 other questions I'd love to ask, so we got to have you back soon. Thank you,
Would love
Dr.
to.
Kimberly Legg Corba. Yeah, direct primary care physician practice, getting out getting the middleman out of the way. In other words, direct primary care, meaning patient, physician. No insurance necessary, right? Pay cash, transparent pricing, low pricing, affordable pricing. Makes sense. I do it. I think it's a winner. Dr. Corba, thanks for serving your community. Wish you nothing but best. Love and honor. Thanks, folks, for tuning in.
Much.
Bye for now. Thank you. Bye. Special thanks to West Penn Life and Health, one of our sponsors. You can find them online at westpennlife.com, specializing in affordable life, health, Medicare, and retirement solutions.